Right, before we wrap up, Health Minister Dr Zweli Mkhize is expected to visit the Eastern Cape today. This as the province has registered 293 cases of the coronavirus. His first stop, the East London call centre. Our reporter Abongile Jantjies is there. Let's get a report from him. Abongile, good morning to you. What's expected today? Is the minister there? And perhaps you can just talk to us how the call centre is working right now.
A very good morning to you too, Leanne. Yes, indeed, the Health Minister, Dr Zweli Mkhize, is expected to visit the province today. Well, his first stop will be this call centre, where information is shared regarding the COVID-19 virus, where the MEC, Abongile, mostly spends their time trying to find information. Well, the province has registered 15 recoveries and 310 confirmed cases to date. Well, the MEC, after here, he'll go to the prison in East London, where the bulk of the cases are here in the Buffalo City Metro. But to tell us more, Leanne, I'm now joined by the MEC for Health in the province, Cindy Swakomba. Ma'am, the minister is coming to the province today. What are you expecting to take from his visit?
Well, it is not necessarily that what we want to take from his visit, but it becomes an imperative part of his work to actually visit all provinces, in particular when numbers are kind of surging. In East London, as we speak, we are having numbers that have never been seen. If you see our statistics and the history and the curve of our statistics, they started being low and suddenly picked up. It is East London, it is also Port Elizabeth in Nelson Mandela. And now we're having another creeping area, which is Krisani. But equally, we have got low numbers in terms of PSJ, which is one of the sources of the numbers that we have. So the visit of the minister is quite critical for us in the sense that he must be able to actually evaluate and assess our readiness as the Eastern Cape and see whether we need any areas of assistance as the country to meet the challenges of the numbers that we're picking up. Quite interestingly is the fact that the issues of mass testing and that people are coming forward to actually report themselves is assisting us in getting to those numbers. Getting to those numbers does give hope that we shall be able to extinguish COVID amongst our communities.
As the province, do you still have it under control, the virus?
Having under control might be interpreted in many ways. One of the ways that we want to believe as health we have a responsibility is that we have it under control if we're able to take it out of our communities. What then needs to match that is availability of places where we can put them, those that are sick and those who cannot self-isolate. In particular, if it moves to those areas where majority of our people would not have accommodation.
Ma'am, thanks a lot for your time. We're pressed for time.
Thank you.
Well, there you have it, Leanne. The MEC briefly telling us what is expected from the minister today. From us here in East London, we'll keep on updating on what's happening on the ground today. From us here, it's back to you in studio.
Thanks very much, Abongile Jantjies, who, of course, is there on the scene and will bring you that story and more, especially when the minister is visiting there. All right.